In this current viral pandemic, where children are being tested for various causes, we see a lot of abnormalities in the complete blood picture, and the more common being the low count of platelets, which becomes very alarming to the parents. So, let us discuss today different causes for low platelets in children, what are the complications, risk associated, and how do we handle it. Low platelets is known as thrombocytopenia, and platelets are the main key factors responsible for blood clotting. So, a drop in levels can make the child more prone for increased bleeding. So, what are the different etiologies for it? Most common being the viral infections, various viral group of infections like dengue, 𝐀𝐛𝐨𝐿, respiratory group of infections like adeno, RSV, metapneumo can cause various degrees of thrombocytopenia. Apart from that, various bacterial infections, fungal infections, protozoal infections like malaria, severe sepsis, shock can cause profound thrombocytopenia. Nutritional deficiencies like deficiencies of B12 and folate can impair the platelet production. Medications such as anticonvulsants, few antibiotics and chemotherapy medications can cause a low platelet level. Autoimmune conditions where the immune system of the body destroys their own cells like ITP and other connective tissue disorders can also cause varied degrees of thrombocytopenia. Bone marrow infiltrative disorders like leukemia and sometimes very rare inherited genetic conditions like severe aplastic anemia, Westcott-Aldrich syndrome, Fanconi anemias can also affect the platelet count. Now, the management mainly would depend upon the underlying etiology. In mild degree of thrombocytopenia, a close follow-up would be sufficient. Platelet transfusion per se is needed only in cases of severe thrombocytopenia where there is heavy risk of bleeding or severe sepsis. In conditions like autoimmune disorders, ITP or connective tissue disorders, medications such as corticosteroids, 𝐕𝐢𝐬𝐭 or other immunomodulators may be given based on the severity of the condition. Nutritional deficiencies such as B12 and folate would need a supplementation of the respective vitamins to settle down the problem per se. So, in cases of severe to moderate thrombocytopenia, a regular follow-up with pediatric hematologist is necessary so that the treatment would be guided based on the condition and major complications could be avoided. Thank you.